That's right. It's chickenpox virus. But it presents in a different way. Right? It doesn't present with a rash all over your body. It presents with a very discrete rash. Very, very painful. Lasts for weeks. Even when the rash goes away, you have pain that lasts for sometimes months and a few people for years. Post-herpetic neuralgia, that's what they call that. Very, very brutal in terms of the way it causes pain. So, shingles. But it presents differently. And we'll talk a little bit more about that. That's one of the vaccines I'm going to talk about. A, California, 2009. What's that? Right. The most recent swine flu. Right? So it's A, California, 2009, H1N1, which replaced, in our new seasonal flu vaccine, it replaced the old H1N1, which is now called seasonal H1N1. But California H1N1 2009, that's now in our flu vaccine this year. So that's the other disease vaccine that I want to talk about today. And then finally, I'll just put an initial as B, Bordetella. Pertussis. Whooping cough. Right. Whooping cough. So that's the third vaccine I want to talk about today. And we want to talk about whether or not it's indicated. In other words, why take it? What are the possible side effects? Who shouldn't have it? And should we all consider taking these vaccines? Okay? So those are the topic areas. If I stray from them, please get me back. Okay, let's talk about the recent flu vaccine that most of you have had. How many of you had your flu vaccine this year? Yeah, just about everybody. Now's the time to take it because the incidence of flu-like illness in this country is really at a low. We're getting less than 2 cases or 5 cases per region. There are 10 regions in the country. And if you look on your CDC website, it's all blue, meaning there's very little activity so far. Now this time last year, we had a lot of stuff going on because remember, 2009 California H1N1 began in Mexico in the spring of 2009 and it went all the way through the summer. So by the time it reached November, there was stuff going on in this country. And we had already had multiple deaths. It ended up with 12,000 deaths in this country. Most of them actually were people under 50 years old. So the recommendation is that we should really concentrate on old as well as young and the entire community. So this year, the flu vaccine is for all Americans. It's being recommended for all Americans above age 6 months. Because if you're less than 6 months, you can't generate the antibody activity. So it's a universal recommendation now, whereas before it used to be anybody over 65, and then 1 year it came down to anybody over 50. Now it's for everyone. Why? Because number one, this is where the bottom line is, very, very low side effects. And number two, we're seeing a pandemic that even though it wasn't the catastrophic pandemic that was predicted, did take a toll in young people. And we expect, like all pandemics, the last one was 40 years ago, but like all pandemics, we expect second or third waves for all those people who didn't get their flu shots or who didn't get exposed to H1N1. We should see some H1N1 activity this winter. Okay, so that's one of the ingredients in this year's flu vaccine. You probably can't see this. I'm going to probably do it in, would red be better?
Black would be better. That is black.
I'm doing it in multiple colors. Huh? No?
That's no good.
All right. I'll just do the fingers. All right, so that's one. And then we have a new H3N2 influenza A virus in the vaccine. And that is from Australia. And it's called Perth 2009. So 2009, I've never been to Australia, so I don't know where Perth is. But they picked up a virus there that's now in our vaccine this year. And an old one for influenza B. So there's 2 A's and 1 B, and this B is from Brisbane. That's also Australia. Okay, so universal recommendations, that's the new thing. Number 2, you might ask, why do we have to get a flu shot every year? Especially if we're really worried about one that was exposed to us last year and one that was exposed to us from 2 years ago. Anybody guess? Our antibody levels wane with time. In other words, in 1 year, your antibody levels against these various viruses will become lower and lower in your blood. Now that doesn't necessarily mean that your resistance is down, but it's enough to generate some concern that we think we should repeat it. And every year, the Centers for Disease Control and the world community set up an advisory committee on immunization practices. It's ACIP. And their experts select a suspect virus that they think will play a role in this year's winter epidemic of the flu, of seasonal flu. So they always pick which virus they think is going to cause havoc. And this year they only came up with one new one, and that's the Perth from 2009. But the one they were really still concerned about is the pandemic virus, H1N1 from 2009. Okay? Another question that comes up is, aren't they making a super flu vaccine for seniors? For people over 65. Have you heard that?
No.
Yeah, I get mixed responses here. So, the company that we use in our office, there are about 8 companies that put out flu vaccine. The company that we use in our office this time happened to put out another high-dose flu vaccine called high-dose Fluzone. And it's a French company, Sanofi Pasteur. So, the idea behind that high-dose vaccine, which is their recommendation for seniors or anybody over 65, is that it has 4 times as much virus coat in it than the usual vaccine. And so they've tested it. Last year they tested it in about 4,000 people, and they found out that if you take 2,500 and you give them the high-dose flu vaccine with the 4 times the amount of virus coats and compare it to another 1,500 that had the ordinary, usual H1N1, that the antibody levels you measure in their blood 1 month later is about 4 times higher. So their reasoning is, if seniors have other diseases or other problems that can make their immune system less than it should be, why don't we give them a more powerful stimulant, a more powerful amount of antigen, so they can react better, therefore generate more antibodies, and therefore have less chance for even a mild flu. The problem that I see, and the reason why we didn't select the high-dose vaccine, was number 1, it's not been shown yet to decrease the amount of flu, because that's just the first year they had it out. It's undergoing what we call phase 3 trials. So the final results aren't in yet. We don't really know if it's actually going to decrease the amount of flu. But the counter argument is, well, you got 4 times the amount of antibodies. Why won't you expect a decreased amount of flu? And there's a little logical problem with that argument. The argument is based on everybody getting one type of vaccine versus another. It's not based on who gets the vaccine the second year. In other words, we've already had our H1N1 last year, and now we're getting a booster shot with the usual flu vaccine. Isn't that just as good? We don't know. So the answer on their phase 3 trials will be out, published in 2012. Interestingly enough, the vaccine costs 4 times as much. So there's a little bit of, marketing and that sort of thing that hasn't been definitely confirmed yet. Certainly the CDC and the Advisory Committee for Immunization Practices, the ACIP, have not recommended it yet. Did that answer the question for those who are asking whether or not we should do that? Right now I consider it a little bit of jumping on the bandwagon too soon. We need to have more data, and they don't have the right argument to me logically put out yet. So the real answer will be, really, bottom line, does it drop the incidence of flu-like illness? Okay. Any questions on that? Okay. So what are the risks of the flu vaccine? Why wouldn't you want to have it? Because there's always people, and especially last year, they were so worried about the swine flu vaccine. Remember CNN and Fox News and everyone saying, oh, you're going to get Guillain-Barré? And they kind of had their experts talk to you about Guillain-Barré, which is a disease where your body, in reaction to the virus, generates antibodies that happen to attack your own nerves. So you have a gradual paralysis, sometimes worse, sometimes mild, that lasts for weeks or even months, and sometimes can bother your respiratory symptom to the point where it can be life-threatening. But Guillain-Barré has been watched now as an incidence of side effects ever since the swine flu mishaps that occurred in 1974 with the emergency swine flu vaccine that was produced in response to an epidemic at Fort Dix. I think Fort Dix is in New Jersey with military recruits. They had some people with a high number of Guillain-Barré reactions. And so since then we've been following, both in this country as well as in other countries, what's the incidence of Guillain-Barré from the flu vaccine, and it's something like 1 in 2 million. Now you say, well, that's 1 in 2 million. That is too much. And in fact, some of our healthcare personnel don't take their flu vaccine because of this kind of concern. But you have to remember that Guillain-Barré occurs due to other things. So this puzzling and difficult disease to treat occurs maybe about 100 cases per week in this whole country. And most times it's due to an infection that causes diarrhea, and that's called Campylobacter jejuni. For the most part, that infection can lead to the antibody response that your body generates, which then attacks your own nerves. And so Campylobacter jejuni is a diarrheal disease that you get from foodborne illness, contaminated food, usually chicken. So I think your chance for getting Guillain-Barré from eating contaminated chicken is much higher than it is from the flu shot. In fact, the flu shot is the least likely thing to cause Guillain-Barré. Even the flu itself can cause a reaction that leads to Guillain-Barré. Any questions on that? I'm just going to pass that because that was sort of blown up as a potential risk of taking the flu vaccine last year and every year. Okay, any questions? Yeah, good.
Is the Bordetella that you mentioned the same virus that dogs get Bordetella? And is it contagious to humans?
Okay.
From the dog?
I don't think it is. It's not.
Repeat the question.
The question was, is Bordetella that I'm going to talk about? It's not, the flu vaccine. Is it the same thing that dogs get? And I think it is, but I have a feeling, first of all, it's not a virus, it's a bacteria. But I don't think it's transmitted the dog one to the human and vice versa. It's really something human to human.
Like this one?
Whooping cough. That's what she's talking about. So is whooping cough something we get from animals? And usually not. Usually it's from human to human. There's another question.
Maybe a silly question, but if one gets the shots and they're on other medications, are there any medications that would have an adverse effect either way on the medicine that's being taken or the immunization that's being given?
I think that's a good question, because they always warn you, don't take vaccinations when you're sick, or in your question, when you're on certain medications. And certain medications include immunosuppressant medications, anything that is lowering your ability to generate antibodies against the vaccine, against the virus particles. So you want to be in a state where you're able to generate a healthy immune response, build up antibody responses to the vaccine particles and the virus particles. So, number one, if you're on chemotherapy, or if you've had a significant cold or bronchitis, which is sapping your energy, then you shouldn't take the flu vaccine then. You should wait. Now, for mild illness, like a little head cold, they say just go ahead and take the flu vaccine. It's not that much of a strain on your body's immune system. Okay, now, I have to kind of actually, by a case-by-case situation, answer that absolutely correctly for the people who have immune-compromising disease such as diabetes. But it's mainly cancer and chemotherapy, especially chemotherapy or AIDS patients. If their immune system is really down, the vaccine won't work.
Got it.
Not that it will cause you problems. Now there are two actual types of flu vaccine. Did you guys know that? Two types every year. One is the live vaccine that you take with a spray in your nose, and the other is the shot. The shot, it consists of inactivated virus particles. It's just the coats of viruses. They cannot cause the flu. They can cause a little reaction to the ingredients in terms of a little fever, maybe a soreness and swelling at the local site. But they don't cause the flu. The live virus potentially can cause, although they've only documented this in little newborns in one study, the live virus can be transmitted because it is live, but it doesn't live at temperatures like 37 degrees, which is what our internal temperatures are. It lives just in the nose at about 32 or 33 degrees, 34 degrees. So that's why it's given in the nose. It just lives there in the nose, and you generate antibodies against it because it's colonized in the nose. So it's actually more effective in terms of generating an antibody response, the live virus, than the shot. But it is not recommended for pregnant women, for people who are immunocompromised, because potentially, theoretically, it can kind of spread in those people whose immune system is weak. Although I have to, most people only have temperatures down to 33 or 34 degrees, even if they are weak. But it is not given, and it also is not suggested for people over 50, or who have asthma or diabetes or any other comorbidities. So is somebody taking? Yeah. So the live nasal attenuated virus is only for people under 50 and for kids, unless they have asthma. No, they don't give it to asthmatics because they don't want to have a flare-up. Okay? Does that answer your question, Ruth?
It sure does.
Okay.
Thank you.
Well, one other thing about ingredients. There was a big fuss at one time because vaccines contain a little mercury-containing preservative called thimerosal. And so, remember, there's a huge ballyhoo about whether or not that preservative could lead to autism, because they've seen the incidence of autism in kids increase over the last decade or two. And they're thinking, well, maybe it's because we're giving so many vaccinations to the kids. So they stopped in 2001, based on political pressure, they stopped the use of thimerosal in the flu vaccine for kids. It is still in it for adults. We get the adult version. But for the kid versions, no thimerosal. Not because there's been any proof. There's actually been 4 huge studies showing that there's no harm from this preservative. But there's so much press and stuff out there that parents are going to be reluctant, and they'd rather have parents give the vaccine with some confidence than have them worried about something that they heard on television. The power of the press. Okay. So let me switch then, unless we have other questions on the flu vaccine, to the other question on pertussis.
Here,
Well, one question there.
if you've
Yes.
had whooping cough, do you need
tetanus shots?
The question was, if you have whooping cough, do you need the shot? Let me answer that question by developing the whole discussion on pertussis, and then if I forget, I'll answer that. Thanks. What we're talking about is the whooping cough vaccine, which is really not just pertussis, it's diphtheria and tetanus at the same time. So they have a word, an acronym for that. They're really thick pieces of paper. I'm just going to put it down here. And that's called T for tetanus, D for diphtheria, and AP, they wanted to make it sound right,
Kids get.
acellular pertussis. Okay, Tdap. So, it's a vaccine that came out in 2005. And originally it was recommended by the ACIP for people under 65. They felt that the DTaP that we got as kids that decreased the amount of diphtheria in the country, D for diphtheria, bigger dose, that's why it's capital D, tetanus, and acellular pertussis. They felt that we get these 6 vaccinations as kids, but by the time we're adolescents, we lose the antibody response. We actually have lower and lower antibodies as we get older. So they came out with a lower dose diphtheria acellular pertussis vaccine, but good enough for adults and adolescents in 2005. And so they said, well, the people who we think are more likely to get pertussis are people under 65. And the key is to prevent pertussis from spreading to other community members, especially infants, because it can kill infants. And in this state, and several other states, but mostly in California, we now have an epidemic of pertussis. It's at huge levels. Okay? Now the problem with pertussis is it's a very difficult disease to diagnose early. Because it starts off with a cold, you have a runny nose, sore throat, and then a cough. And the thing that then distinguishes it is several days later the cough gets so bad that you cough, cough, cough to the point where you either wet yourself or break some ribs or pass out, and they even show pictures of kids with black and blue marks on their cheeks because they've been coughing so hard. It's a violent cough. Violent cough. People can faint, from coughing so much they don't get blood going to their brains. So it's miserable to go through. So the question you always ask, in an epidemic, should we kind of draw an age line that says 64 and anybody above 64 is not going to be exposed? I think they've had some second thoughts about that. So late last month, the ACIP took a vote. They said that any senior above 65 or over, who especially is going to be exposed to kids less than 12 months, should get Tdap. Whereas before, in 2005 and since, they said no, just 64 and younger. But now it's expanding. The other thing they got was, the other recommendation or statement they made was a little looser, which I interpreted in my own way. And that other statement was, if you're going to have tetanus shots every 10 years, you might as well substitute one Tdap for one of those tetanus shots. And then you'll be protected with your tetanus, and then you'll also have the acellular pertussis protection. Okay? So they said, well, for people over 65, even if you're not exposed to 12-month and younger kids, you can think of getting a shot instead of your usual tetanus shot. God bless.
Thanks.
I say that in an epidemic, we should get it. So I went to a pharmacy and got mine. Medicare doesn't cover it, and insurance is variable in terms of its coverage. Maybe $60, $70 for that. So that it's a Tdap shot. I think it's worthwhile preventing the disease in you, and of course with any contacts that might go on to young kids. I'm going to discuss this concept of herd immunity, okay, because it has to do with this disease, diphtheria. I'm sure none of you have seen a case of diphtheria. It's pretty rare.
Diphtheria?
Diphtheria. It's that D part of that shot. Okay, so we all say, oh, okay, well, you know, we've got vaccinated against diphtheria when we were kids, and now why do we need it when we're adults? Well, the reason is that if you test antibody levels in adults, let's say over 65 years of age, 1/3 of Americans have enough antibody levels, the rest are all low. Why don't we have diphtheria? And diphtheria, by the way, can cause severe respiratory infection as well as a skin disease, but usually it's the respiratory infection that is harmful. We haven't had it for decades, especially in developed countries. But it still exists in countries like China, in Egypt, Turkey, etc. Guess who visits them once in a while, right? Americans visit them once in a while. So it's possible if you have a less than optimal level of antibody against diphtheria, you might pick it up again. So they think we have to get ourselves updated, but that's one of the ingredients of Tdap. The reason why they think we don't have very much diphtheria in this country is this concept of herd immunity. Everybody's around you is protected to some degree, and so the disease died off. It just didn't get here. And then after a while, we lost our immunity, but it didn't make a difference because the disease wasn't around, unless somebody brings it in from other countries. So on average, we get maybe 2 cases per year in the entire U.S. of diphtheria. Okay. So the concept of herd immunity is an important one as an incentive for us to get our Tdaps or our other vaccines, because we want to protect the whole community too. The incidence of side effects with these vaccines are so low. Again, with the Tdap, a little bit of soreness, maybe one day of a little low-grade fever, if you're one of those 1 or 2% of people who can react to it. Yeah.
When my kids were babies, they got the triple shots.
The D-Tech.
Typhoid and whooping cough.
Yeah.
Now, isn't that going to hold?
Yeah, it holds until they're about 11 or 12 years old. And they actually get 3 shots before 6 months, another shot at 1 year or something like that, and another shot at 6 years. So they take 5 of those shots. No wonder mothers are worried, right, about the vaccine. So that's Tdap. Yes?
As a child in Canada, it was compulsory that we had to have what they called a toxoid shot against that diphtheria. But they had diphtheria cases going around then.
Okay, yeah. But I think in the last, I would bet that Canada has a very low incidence right now.
Oh, yes.
You know.
I'm sure it is.
Yeah.
It wasn't.
Okay. Let's talk about shingles. Can you catch shingles? If I have the shingles, can you catch it for me? How many say yes? There's one. There's 2. You can catch it if you've never had chickenpox. Because remember, it's the chickenpox virus.
Yeah, I know.
Okay? But usually you can't, because nearly all of us have had chickenpox,
Yeah.
even though we don't remember. So you can measure it by antibody levels in your blood. A lot of people have subclinical infections. In other words, they don't get the rash as a kid, but they get exposed to it, so they really went through it. But you don't get chickenpox from the shingles because you've already had it. Now, how come you can get shingles, though? If the person who has shingles gets shingles, why did their chickenpox not prevent them from getting shingles? Well, it's because when you get the chickenpox and it dies out, it doesn't really die out. There are a few viruses that kind of live in your nerves. And they live in an area where it's not exposed to antibodies and away from the blood, nerves, in the nerve sheaths. Okay. So something triggers the virus to wake up And usually it wakes up just along one nerve. That's why you get these bands of rashes on one side, not on both sides, for example. The worst thing is to get it in a band right over your eye. And you can get keratitis and blindness, and besides the pain, it's miserable. So this chickenpox virus lies sleeping there until something happens. What is the something that happens? Usually it's a period of stress. You know, I've heard of college students, people studying for their boards, their law boards, and that awakens, they get shingles in preparation for their exam. Other people get sick for other reasons that causes stress, and then that will cause the shingles to flower. Now the problem is that shingles, the incidence of shingles gets higher and higher as you get older and older. In other words, if you haven't had shingles by the time you're 50 or 60, there's going to be a higher chance in the next decade or two that you can get it. So it's something you got to pay attention to because it's miserable. It's miserable. Somebody said miserable? Yeah.
No. I just know somebody that just went through that's 95.
They don't reoccur though, do they?
I have a question.
Okay. Well, let me just address that point. Can they reoccur? Well, if you think about it this way, the chickenpox virus is sleeping along the nerves. The stress wakes up the chickenpox virus in one nerve and it flares up. Then it dies back down again. What's happened to the rest of the chickenpox virus is still there. Some people can get shingles 2 or 3 times a life. You know? So just having shingles doesn't mean that you shouldn't get the shingles vaccine.
I had shingles.
Question?
Can you have shingles without a rash?
You gotta spread something.
Usually not. Although you can get shingles early with just the pain. And then a week or so later you get the rash. It would be hard to show that it was shingles without a rash with the usual blister and redness. You know, but you can. I've seen cases where the pain appears first, and nobody can figure it out. They're doing all kinds of CAT scans, and then a week or 2 later there's the rash, and then we all look kind of dumb. Yeah.
We gave me a prescription for shingles. It's a shot for shingles. And I went to my pharmacy, and they said they hardly ever get it in. They haven't had it in 5 months. And you might want it, but where do you get it?
Okay. I had to call around myself because I got it 2 months ago myself. It is, by the way, being recommended for anybody over 60. So you have to call around, and if you call around, say, let's say a Ralph's, then you say, well, what other Ralphs might have it? Because I had to go all the way up to the 405 on Hawthorne Boulevard for the Ralphs there. And what I understand is they have it at one pharmacy, and then another month they might move it to another pharmacy. They're trying to get the business. And the reason why is because you can't store it for too long. It's a very weakened virus that is alive, but very weakened. It's fresh, freeze-dried actually. Then you have to reconstitute it in a diluent, and then within half an hour you have to get it. You have to shoot, you have to give the shot. So the other disadvantage, besides trying to find it, because it's usually not in every doctor's office. There are a few doctors though that are stocking it. One of the GI groups, I understand, has their freezer full of this stuff. So I'll tell you later on who that is. And then one of the allergists, who's a very prominent allergist, has it too. She's giving it. The other disadvantage is it costs a fair amount, as I learned. And Medicare, again, doesn't cover it. Medicare only covers influenza, pneumonia vaccine, and hepatitis vaccine. So we're talking a few $100s here. And that's expensive, and so, but it's one of those things you want to kind of say, okay, now, that's shingles versus the cost, one-time cost. Is it worth it? It's one of those individual decisions. But see me later and let me see if I can help you through that. But the name of the vaccine is called Zostavax, after herpes zoster. Zostavix. VAX. Yes.
After you've
Question?
had the shingles, can you still take the vaccine?
Yes.
You do?
Yes.
How long does it last for?
It's a one-time shot. Now, how long is it going to be effective? You know, all of that is always debatable because you can't just measure antibody levels. You have to measure inducible antibody levels. That's the point I was trying to make before with the high-dose flu vaccine. So I would say it's just a one-shot deal. Yeah. Question?
Walgreens has 2 questions. You have to go to else you're going to do. And the second part is that I read Medicare and you for 2011, Medicare Part B will cover the first class. But we don't have a Part B Medicare, so.
Yeah. So those are the plans that Medicare is going to change with the new health care reform. Thank you for that. That's good information. So there's one source of information there that's helpful. Yes, question?
If you've had the shingles shot, can you still get the shingles?
I haven't heard of that, but I have a feeling you can. Hopefully, let me correct that. You can. You can get it, but the attack is less painful and the post-herpetic neuralgia is less. So it's going to be a milder version of it.
I think I've had the milder version.
Of after the shot shingles?
Yeah, I've had the shot when it first came out.
Oh, okay. No, it's not. None of these vaccines are totally protective. You can still get the infection, but it's of a lesser severity. So that's the advantage of this. Okay. Any other questions on that? Okay. So I think the big disadvantage for this is that we don't have enough insurance coverage for some of these vaccines now. But I guess my message to you is that all 3 vaccines can be and probably should be given for seniors. Okay, so with that I'm going to stop unless there are further questions about the flu or anything else here. There has been some miscommunication about some of the vaccines, so I thought it would be worthwhile just going over some of these details. Thank you for your attention.